Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about why I hate Pontics on braces and why I prefer any patient that needs a Pontic or is asking for a Pontic to have actually Invisalign. All the other aligner companies just have inferior Pontics, just from my experience. They can't match the size, the shape, the width, the contour. Invisaligns are hands down the best. So let's talk about why I don't like Pontics on braces. And I'm not even going to do a demo because I hate and detest doing this so much. I've definitely done it in practice. It is a complete and total nightmare. So way back when, before Invisalign really came out, there was no choice. You had to do Pontics on braces, and it was the biggest pain in the butt. It literally wasted so much of your time, and it's basically doctor time or very experienced time, and you really can't charge more for these cases, even though it doubles your chair time. I mean, I guess you could, but most people have insurance and that's not gonna fly. You don't get to charge extra for that. So, and no, you can't wear a flipper because basically a flipper is going to need clasps for the most part, or if it's retained by the palate, your teeth are going to be changing throughout treatment. So you literally have to get a new flipper every month. So that's not cost effective, although that would be easier than doing what you have to do. I mean, I guess in theory you could build that in, but that's probably not going to fly, right? That doesn't make sense because that's going to be like wasting so much money. So basically, here's the way it works, and I'm not going to show you a demo because I got better things to do. This is a complete waste of time. I don't want you doing this. So I'm going to explain the process. First of all, let's say, for example, this patient. Let's say you wanted to have a Pontic here. Well, as time goes, you're going to have to get a tooth, a denture tooth that fits the size of the space, fits the shade, fits the contour, matches this. What a pain, right? So in theory, you could take a scan and send it off to some type of crown and bridge lab. That's the easiest way to do it, and ask them to match it. They'll send you back the denture tooth. I mean, way back when, I had like piles of denture teeth in my lab, and I would just go look for one. I'd go hunting. So yes, you could do that. They'll send you the denture tooth. Then what you're going to have to do is you're going to have to basically kind of drill the gingival part so it looks like it's nicely emanating, but you don't really want to insert it in a sulcus or something like that, and then you're going to have to lay it here somehow and bond the bracket just like you're bracketing the other tooth so that the bracket is symmetrical, so it doesn't hang low, it doesn't go high, it's not rotated. It's really difficult to do. The thing goes flying all the time. And trying to bond a bracket on a Pontic tooth is not that easy because it's really not meant to bond to plastic. If you've ever had typodonts, the things break like crazy. I mean, super glue works, but super glue is toxic to humans, so you can't use that. So you gotta use composites. You gotta basically like create some mechanical retention points. So usually I'll take like a 557 burr and in the denture tooth vertically, so that hopefully the composite goes down in there and you have mechanical retention. That's the best way to get it, is mechanical retention, but it's still gonna break, okay? It's gonna break a lot, so I suggest having a lot of backup teeth because this is gonna happen. And when the darn thing breaks, it is a real emergency for the patient because they don't have a front tooth anymore and they are gonna freak out on you. So you're gonna have patients calling you all kind of weekends, evenings, freaking out. I have a dinner, I have an event, I need you to fix my Pontic. Fixing it takes an hour or two. So again, huge waste of my time. Especially when you can do Invisalign with pretty much every case and they can just fill it themselves. It's like I have great videos on how patients can fill their own Pontics. So easy, right? So anyways, you got that going on, and then when it's in the initial wires, like this is a heavy wire, so this is not a problem if you had one there. But when you're in the initial leveling and aligner wires, like the 12s, the 14s, the 16s, the 18s, the rounds, even the 1622s, even the 1725s, it's gonna flop around a little bit, right? Unlike other teeth which are in the bone, we're not sticking this in the bone, so it's going to be kind of wiggling and flapping in the wind. The patient tends to play with it and it wiggles around, and it's real easy for the patient to flip it, to rotate it, to invert it, and to break it because they play with it, right? Because it wiggles. It just doesn't look right. Patients hate them. Ultimately, when you get up to a really heavy wire like a 1925, the very end, it turns out fine. That's not a problem. But the other thing that's kind of crazy is every time you have to untie and untie, you're gonna have to stabilize it and ligate it back on. And it's really easy for teams to forget that one of those is a Pontic, so it often goes flying across the room when you untie, or it falls down the patient's throat. That's not good. So you literally have to put a huge alert on your chart, on everything, remind the patient to remind you, this is a Pontic, this is a Pontic. Anyways, big waste of time. Don't bother doing it. If your patient is missing front teeth and is requesting a Pontic, sometimes patients don't care if it's like a lower one, but if it's from here to here, it's an Invisalign case only. They got to pay for it. That's how it is. Unless they want to get a bridge or something or an implant, but then that affects your ability to be able to do the treatment. So a lot of times we're placing the implant after we do the ortho. All right, thanks so much.